Hello guys, this is Dr. Movva Srinivas. I'm a cardiologist. So today we'll discuss about high blood pressure called as hypertension. So blood pressure is the pressure exerted by blood in the blood vessels. So that is measured by different means, by mercury based machines, now electronic machines. But basically these measure the pressure in the blood vessel exerted by the blood. If the blood is more, the pressure is more. The blood is less, the volume is less, pressure falls. So basically it is the pressure exerted by the blood called blood pressure. Now if you commonly say some people have high blood pressure, some people have low blood pressure. So obviously they are meaning that there is some number in mind beyond which this is called as high blood pressure, below which it is low blood pressure. So that magic number is 140/90. There are several different guidelines. Indians have guidelines, Americans have guidelines, Europeans have guidelines, but the common thing you can remember or general thing you can remember is somebody has a measured blood pressure more than 140/90. It is called as high blood pressure. As I was mentioning now, there are two numbers you have to consider. There are two numbers when they say BP, blood pressure. There are two numbers, 140/90. So it is called as systolic and diastolic. I don't want to confuse you. Just remember that there are two numbers to remember. The upper number is usually more, lower number is less, 140/90. So now people can have varying blood pressure numbers, varying numbers at different times of the day. Usually that blood pressure is high in the mornings and slowly decreases by evening. So blood pressure measured at any different point of time in a day can be different. So that is to be, do not panic about this. Just remember that different times have different blood pressures. Generally, these need not be considered, but any measured blood pressure more than 140/90 is high blood pressure. Now, somebody can have blood pressure of 130/90. So can he relax saying that I don't have high blood pressure? Not really, because blood pressure more than 120 but less than 140 is called as pre-hypertension, meaning the person does not have blood pressure. He has the risk of developing high blood pressure. So 120 to 140 is pre-hypertension. So similarly, 120, so 80 to 90 diastolic is pre-hypertension. So these people should take measures to decrease their blood pressure so that they won't develop blood pressure anytime in the future. So these measures are commonly weight reduction and reduction of salt intake. These two measures. Every kilo you lose decreases blood pressure by 3 to 4 millimeters of mercury. So weight reduction will decrease the blood pressure without the need for treatment on a long term. So these patients, especially people who have a strong family history of hypertension, please check your blood pressure. If more than one person in your family, one person closely related to you, uncles, aunts, or even parents, brothers and sisters, if you have hypertension, more than one, you have a strong family history of hypertension. So check your blood pressure periodically, at least maybe once in a fortnight or once in a month. If it is more, or if it is more than 140 or between 120 to 140, then you should take measures. Commonly, we give you 2 months when you can reduce your weight, decrease your salt intake, and so that you don't develop hypertension in the future. So guys, this is to educate you to what is defined as high blood pressure. So remember 140/90, but between 120/80 to 140/90 is pre-hypertension, and these people are in fact lucky because you caught it early. Now you can reverse it by decreasing weight and decreasing salt intake. Thank you.